transplantation indications and management. Heart transplantation is the surgical replacement of the heart in patients with end-stage cardiac failure. This procedure remains a viable therapeutic alternative for patients in specific disease states. Indications for heart transplantation: dilated cardiomyopathy, ischemic cardiomyopathy, congenital heart disease for which no conventional therapy exists or for which conventional therapy has failed, ejection fraction less than 20%, intractable angina or malignant cardiac arrhythmias for which conventional therapy has been exhausted, pulmonary vascular resistance of less than 2 Wood units, age younger than 65 years, ability to comply with medical follow-up care. Biventricular failure with F20% in echocardiogram. Recurrent pulmonary edema despite maximum inotropic drugs. Contraindications for transplantation. Age older than 65 years, this is a relative contraindication. Patients who are older than 65 years are evaluated on an individual basis. Fixed pulmonary vascular resistance of greater than 4 Wood units. Active systemic infection. Active systemic disease such as collagen vascular disease or sickle cell disease. Active malignancy. Patients with prior malignancies who have demonstrated a 3 to 5 year disease-free interval may be considered, depending on the tumor type and the evaluating program. An ongoing history of substance abuse, e.g., alcohol, drugs, tobacco, psychosocial instability. Inability to comply with medical follow-up care. Laboratory studies. Virus, including hepatitis viruses, human immunodeficiency virus, HIV, Epstein-Barr virus, EBV, and cytomegalovirus, CMV, used to determine past exposure and currently active disease. Fungus and tuberculosis, TB. Used to determine past exposure and to predict reactivation. Prostate-specific antigen, PSA, if elevated, initiate appropriate evaluation and therapy before completing the evaluation for transplantation. Papa-Nicolau test, results should be negative before listing for transplantation. Complete blood count, CBC, with differential platelet count, prothrombin time, PT, activated partial thromboplastin time, APT, and a complete chemistry profile, including liver panel, lipid profile, and urinalysis. Blood typing and screening, panel reactive antibody, PRA, testing, and tissue typing, used to determine the immunologic suitability of the patient for transplantation and donor matching. Imaging studies. Imaging studies. Coronary angiography, performed in cases of cardiomyopathy to determine if the cause of the cardiac dysfunction may be amenable to conventional therapies. Echocardiography, used to determine the cardiac ejection fraction and to monitor the cardiac function of patients on the transplantation waiting list. Posterior-anterior and lateral chest radiographs, used to screen for other thoracic pathologies that may preclude transplantation. Bilateral mammograms, should reveal no abnormalities before listing for transplantation. Cardiac and pulmonary evaluation. Maximal venous oxygen consumption, MVO2, used to assess overall cardiac function and as a predictor of the severity of congestive heart failure and survival. Right and left heart catheterization, used to determine if the disease process is reversible or treatable by more conventional therapy. Pulmonary vascular resistance, patients with fixed resistances above 4 Wood units are not candidates for heart transplantation. Coronary angiography before transplantation. Right heart catheterization. Chest radiography. Biopsy study. Endomyocardial biopsy of the potential candidate is not routinely performed. The procedure may be considered if a systemic process involving the heart is thought to be the cause of the cardiomyopathy. Perform biopsies of appropriate areas if the patient exhibits symptoms of systemic disease. Biopsies are used to determine the extent and activity of the disease process. Systemic disease processes are a contraindication to cardiac transplantation. Cardiac biopsy from right ventricle or left ventricle. Two types of transplantation procedures. During the cardiac transplantation procedure, the ventricles are excised, leaving the great vessels, right atrium, and left atrium of the recipient. The donor heart is then sewn to these areas. A cardiac allograft can be sewn in either a heterotopic or an orthotopic position. Heterotopic transplantation is an excellent technique for patients with severe pulmonary hypertension. Inherent problems with the technique, however, include pulmonary compression of the recipient, difficulty obtaining an endomyocardial biopsy, and the need for anticoagulation. Heterotopic transplantation. Orthotopic heart transplantation is performed with either of the following techniques. 1. Shumway-Lower technique. This method is simpler and saves perhaps 10 to 15 minutes of ischemic time. 2. Bicaval anastomosis. One advantage of the bicaval method is that, by avoiding a large right atrium, the surgeon can maintain better atrial transport. Another claimed advantage of this technique is a lower reported incidence of tricuspid regurgitatio. Bicaval/orthotopic transplantation. Immunosuppressive therapy. Immunosuppression is started soon after surgery. Several regimens can be used, including pre-transplantation induction therapy and simple postoperative maintenance therapy. The choice of regimen depends on the training and experience of the transplant center. Most maintenance immunosuppressive protocols after HTX use a 3-drug regimen consisting of a calcineurin inhibitor, CNI, cyclosporin or tacrolimus, an antimetabolite agent, mycophenolate mofetil or azathioprine, and tapering doses of corticosteroids over the first year post-transplantation. Complications after transplantation. Post-transplant complications can include the following: bleeding from suture lines, hyperacute rejection, infection, psychiatric disturbances from steroid therapy, cardiac rejection, allograft vascular disease. Patient education. The 1-year survival rate after cardiac transplantation is almost 90%, and the conditional half-life, the time at which 50% of patients who survived the first year are still alive, is 13 years. After transplantation, adult patients with congenital heart disease have high 30-day mortality but better late survival. The functional status of the recipient after the procedure is generally excellent, depending on his or her level of motivation. In patients with severe biventricular failure who received pneumatic biventricular assist devices as a bridge to transplant, the 1-year actuarial survival rate was 89%, compared with 92% in patients without a ventricular assist device. Hypertension, diabetes mellitus, and obesity are associated with exponential increases in postoperative mortality rates. Heart transplant recipients with all 3 of these metabolic risk factors were found to have a 63% increased mortality compared to patients without any of the risk factors. Evaluation of the heart transplant candidate includes laboratory tests, imaging studies, and other tests as appropriate. Closely monitor the heart transplant candidate for signs of clinical deterioration during the waiting period for a suitable donor organ. Administer standard therapy for congestive heart failure, CHF, and offer the patient the alternative of participating in experimental clinical trials. Such participation does not preclude listing for transplantation. Maintain close contact with the transplant center, keeping the consultants informed of ongoing medical and social issues pertaining to the candidate. Drugs used after transplantation. Cyclosporin is a cyclic polypeptide that suppresses some humoral immunity and, to a greater extent, cell-mediated immune reactions such as delayed hypersensitivity, allograft rejection, experimental allergic encephalomyelitis, and graft versus host disease for various organs. Prednisone is an immunosuppressant, used for the treatment of autoimmune disorders. It may decrease inflammation by reversing increased capillary permeability and suppressing polymorphonuclear, PMN, leukocyte activity. It is an oral steroid with approximately 5 times the potency of endogenous steroids. Minimal to no oral prednisone should be given for the first 21 days after transplantation unless rejection occurs. Tacrolimus suppresses humoral immunity, T-cell activity. It is a calcineurin inhibitor with 2 to 3 times the potency of cyclosporin. Tacrolimus can be used at lower doses than cyclosporin, but it has severe adverse effects, including renal dysfunction, diabetes, and pancreatitis. Levels are adjusted according to renal function, hepatic function, and adverse effects. Mycophenolate mofetil inhibits inosine monophosphate dehydrogenase, IMPT, and suppresses de novo purine synthesis by lymphocytes, thus inhibiting their proliferation. It inhibits antibody production. Azathioprine antagonizes purine metabolism and inhibits synthesis of DNA, RNA, and proteins. It may decrease proliferation of immune cells, which results in lower autoimmune activity. Antimetabolites are used to block the uptake of vital nutrients needed by the cells. Sirolimus, also known as rapamycin, is a macrocyclic lactone produced by Streptomyces hygroscopicus. It is a potent immunosuppressant that inhibits T-cell activation and proliferation by a mechanism that is distinct from those of all other immunosuppressants. This inhibition suppresses cytokine-driven T-cell proliferation by inhibiting progression from the G1 phase to the S phase in the cell cycle. Dobutamine is a sympathomimetic amine with stronger beta than alpha effects. Dobutamine is a sympathomimetic amine with stronger beta than alpha effects. It increases the inotropic state. Norepinephrine stimulates beta-1 and alpha-adrenergic receptors, increasing cardiac muscle contractility and heart rate, as well as vasoconstriction. Epinephrine is an alpha-agonist. Effects include increased peripheral vascular resistance, reversed peripheral vasodilatation, systemic hypotension, and vascular permeability. Its beta-2 agonist effects include bronchodilation, chronotropic cardiac activity, and positive inotropic effects. Heart transplantation could be avoided in 98% cases, if a patient had properly evaluated and any complaints given more importance.